Feeling like you're always in line at the restroom? Are your bathroom breaks turning into marathon sessions? Could your love for late-night drinks be the culprit behind your constant trips to the toilet? You might be suffering from benign prostatic hyperplasia, commonly known as BPH. But don't worry, since in this video I am going to tell you how to diagnose this illness and how you can improve your BPH naturally. In the complex landscape of the male body, there exists a walnut-sized gland called the prostate. It is nestled snugly below the bladder and just ahead of the rectum, and plays a crucial role in the intricate mechanics of urination and reproduction. You see, your body's built-in plumbing system relies on a delicate network of tubes, and one of the main conduits is the urethra. This tube carries both urine and sperm out of the body with precision. However, as many things in life, the prostate is susceptible to change. Sometimes it decides to grow beyond its usual bounds. This condition becomes problematic when the enlargement is significant. When the prostate enlarges, it can exert pressure on the urethra, hindering the smooth flow of urine and ejaculation. It's important to note that BPH is non-cancerous. The good news, despite its troublesome nature, BPH isn't cancerous. And while BPH itself isn't a cause for alarm, its symptoms could be masking something more serious lurking beneath the surface: prostate cancer. This means that while it doesn't cause cancer directly, it's possible for one to have both BPH and prostate cancer simultaneously. Now be sure to stay to the end of this video, where we will discuss how you can naturally manage your prostate health by making simple changes to your diet. First of all, let's discuss the risk factors of BPH. Well, it does not affect all men equally. When it comes to figuring out why our prostates decide to enlarge, age plays a big role, along with changes in our testicular cells and testosterone levels. Men who lose their testicles early in life, like due to cancer, seem to dodge the whole prostate enlargement issue altogether. But if a guy's already dealing with an enlarged prostate and then has his testicles removed, the prostate starts shrinking, but it's not your standard treatment. As we get older, the chances of our prostates getting bigger increase. In fact, researchers say if you stick around long enough, you're pretty much guaranteed to deal with an enlarged prostate at some point. It's wild to think about, but a lot of guys over 40 already have a little bit of prostate enlargement going on. And by the time we hit 80, more than 9 out of 10 of us are dealing with it in some form or another. And aside from having normal testicles, researchers have discovered that a family history of BPH, particularly if your father had the condition, obesity, a sedentary lifestyle, and the presence of erectile dysfunction are also significant risk factors. And now let's discuss the symptoms associated with BPH. Among the symptoms of this illness, frequent urination stands out as a primary indicator. This symptom arises as the enlarged prostate exerts pressure on the urethra. You see, this pressure impedes the flow of urine, which eventually leads to more frequent bladder contractions. You may also find yourself needing to urinate often, including during the night, a condition known as nocturia. While this is a hallmark symptom of BPH, it's worth mentioning that other health issues like urinary tract infections or the presence of bladder stones can also cause frequent urination. Another symptom worth discussing is urgency, defined as a sudden, compelling need to urinate, which may occur even when your bladder isn't full. This symptom, much like frequent urination, stems from the pressure the enlarged prostate places on the urethra. And we all know that the urgency to urinate can significantly disrupt daily life. In my opinion, it can potentially lead to incontinence if you cannot reach a bathroom in time. This urgency, while a common sign of BPH, can also arise from other medical conditions. Moreover, if you have BPH, you may also notice a weakened stream of urine, particularly at the start of urination. This symptom can make it challenging to fully empty the bladder, potentially leading to urinary retention. Not only is this condition frustrating, but it also increases the risk for further complications, such as urinary tract infections, bladder stones, and incontinence. And according to researchers, An interrupted flow of urine, where the stream starts and stops, is another symptom of an enlarged prostate. This symptom suggests that the urethra is not fully open. This issue can further complicate the act of urination, contributing to the sensation of not fully emptying the bladder. And here it is important to note that there are other conditions that can lead to this issue as well. These include infections or swelling of the prostate, disorders affecting the nervous system, issues with the muscles in the pelvic area, or even as a repercussion of certain surgical procedures. You may also notice a leakage or dribble of urine even after finishing urination, and researchers say that the root cause of this symptom is the pressure exerted by the enlarged prostate on the urethra. It basically hinders the seamless flow of urine from the bladder. Consequently, this can result in post-urination dribble, which might leave you feeling as though there is residual urine in the bladder, and I know that this dribbling can be both inconvenient and embarrassing. In fact, it can potentially lead to uncontrolled urine leakage or incontinence. Moreover, it heightens the risk of skin irritation and infections within the urinary tract. Well, this means that BPH increases your likelihood of developing urinary tract infections due to urine remaining in the bladder longer than it should. If you feel pain or a burning sensation during urination, it might be another symptom that you have BPH. Most importantly, if you notice blood in the urine, consult your doctor immediately. It is a medical condition called hematuria, and it is also a symptom of BPH. But why does it happen? Well, you see, the pressure from the enlarged prostate on the urethra may cause irritation and inflammation, leading to blood in the urine. Now, the color can vary from a faint pink to a more noticeable deep red. However, blood in the urine can sometimes only be detected through a laboratory test, so you should look out for other symptoms too. Moreover, it is important to keep in mind that blood in urine is also a symptom of more serious medical conditions like prostate cancer. But why do we need to understand the symptoms of this illness? Well, if you want to get a proper treatment in a timely manner, understanding the risk factors is essential. I would say that having awareness and early detection can lead to effective management of symptoms and improve the quality of your life if you are affected by BPH. Again, you should keep in mind that not everyone with BPH will notice these symptoms. You might experience only a few of these symptoms. The good news? Well, as medical research continues to advance, so too does the understanding of BPH and the development of treatments aimed at alleviating symptoms and addressing the condition's root causes. Now, did you know that your daily diet could be the key to diagnosing and managing BPH? You see, most men overlook the impact of their diet on prostate health. But what if I told you that by making a few dietary tweaks, you could potentially avoid the pitfalls of BPH altogether? Stick around to find out how. Understanding the role of diet in managing prostate health is crucial. So, researchers have discovered that certain dietary habits can play a significant role in either reducing or increasing the risk of prostate cancer. What you need to do is to start with red and processed meats. I know the allure of a perfectly cooked steak or the aroma of bacon can be hard to resist. However, high consumption of these foods can increase your risk of BPH and even prostate cancer. So what you should do is consume red and processed meats in minimum quantities. And if you are wondering why eating perfectly cooked steak causes BPH, well, it is because of compounds called heterocyclic amines, HCAs, which are produced when meat is cooked at high temperatures. According to researchers, HCAs can increase your risk of various cancers. However, there's no need to despair. A variety of tasty and nutritious protein sources are available that can serve as alternatives to red and processed meats. For healthier protein options, I would suggest that you consider adding skinless poultry, such as turkey or chicken, to your diet, or opt for fresh fish like salmon or tuna. Moreover, plant-based proteins like beans, lentils, chickpeas, nuts, and seeds are excellent choices too. If you are looking for meat substitutes, tofu and tempeh can be used as replacements for red and processed meats. Now, let's talk about dairy products. Generally, you should be cautious with consumption levels. Yes, I agree that dairy products can be part of a balanced diet. However, if you are consuming excessive amounts of dairy products, you are at a higher risk of BPH and prostate cancer, especially if you are consuming dairy products high in fat like whole milk, cheese, yogurt, and butter. Again, you don't need to eliminate dairy entirely. You can go with non-dairy alternatives that can fulfill your needs without the added risk. Options include plant-based milk such as almond, soy, coconut, and oat milk. If you are someone with a sweet tooth like me, a range of non-dairy ice cream made from these milk alternatives is also available. Talking about your calcium intake, again, it is essential to strike a balance. Some research suggests a link between high calcium intake and an increased risk of prostate cancer. However, calcium is still vital for bone health and preventing osteoporosis. So what I would suggest is that you aim for the recommended daily intake of calcium through dietary sources rather than supplements. It is better to consume foods rich in calcium like dark leafy greens, almonds, and fortified plant milks. But most importantly, moderation is key when it comes to alcohol consumption. Enjoying an occasional drink is fine, but excessive drinking can significantly raise the risk of prostate cancer. Medical professionals recommend men limit alcohol intake to no more than 2 drinks per day to maintain good health. Now, if we talk about saturated fats, their link to prostate cancer isn't concrete, but moderation is key. Some new research suggests a possible association between the consumption of saturated fats and a heightened risk of developing advanced prostate cancer. If you want to improve your prostate health and overall wellness, shifting towards healthier fat sources is beneficial. In this case, options include fish, avocados, nuts, olive oil, and seeds over high saturated fat foods found in certain meats, dairy, dressing, pastries, and processed items. And when you are cooking, try health-conscious substitutions, like using unsweetened applesauce in place of butter for half of the amount in baking recipes. Avocado makes a great spread for toast and can act as a healthier alternative to mayonnaise in sandwiches, offering a tasty way to benefit your prostate health. Simply put, maintaining a balanced diet, regular medical checkups, early detection, and an active approach to health can significantly impact outcomes. That's all for today's video, and I hope you found this video helpful. While you are here, click to watch one of these 2 videos appearing on your screen right now. I will see you there, and remember to subscribe to stay up to date on our latest content.